I think one of the excitements that I'm feeling now is the movement of our cardiovascular center. You know, we started out really with an empty hospital when I came in 1992, and now we've grown a hospital that's in the top 20 in the nation. Our heart program's in the top 20. It's been recognized around the country of all the specialty things that we do. We are experts in minimally invasive valve surgery, aortic endostenting, aortic care in general. You know, I would like to say, and I really believe, there's nothing you can call Keck about in the cardiovascular space that we can't care for. And that's the reputation we have out there now. So my vision for the future is to build on what we've started. And I will use that word emphatically, we've just started.
Heart surgery is recommended after a patient has seen their primary care physician, who diagnoses that something is going on and normally will refer them to a cardiologist. When the patient sees the cardiologist, he will evaluate them and probably order some testing, an echo, cardiac catheterization, CT scan. Life after heart surgery at Keck Medicine of USC is extremely good. We have been doing 1,000 open hearts a year for the last 10 years, and patients do very well. They spend 1 day in the intensive care unit and 4 days on the floor. They go home. When they're home, they're able to care for themselves. They can walk outside and do normal activities. Recovery time is 1 day in the intensive care unit, 4 days on the floor. They go home, they're walking, they're able to eat normal diets. We allow them, if they have had a sternotomy, to start driving an automobile at 4 weeks after surgery. If it's a sternotomy, we do not let them lift anything more than 5 pounds for 6 weeks. At 10 weeks, they're completely recovered. All restrictions are gone. They can participate in sports, travel.
Team is really a good word for cardiac surgery, because the reality is cardiac surgery really is a team sport. It requires a lot of different people with different expertise to take care of a patient and get great results. I think what I'm really proud of here is the team that we've assembled around the patients. We've got a bunch of top-notch surgeons with really targeted expertise, but even outside of that, they're great people, they're great partners, and they're great colleagues. In addition, our training program, one of the largest in the country, has a group of residents that are just outstanding. I feel like I'm working more with my colleagues than I am with my trainees at times. In addition, we've got long-standing relationships with all members of the cardiac surgery team here, whether it's the perfusionists, the nurse practitioners, the physician assistants, our scrub techs in the OR, our anesthesiologists. We've built up just a wonderful atmosphere where people get along and are really goal-centered to take care of any given patient. It's really been a pleasure to spend my whole career here at USC, and I couldn't be more proud of the team we have.
Vascular surgery division special is really the type of surgeons and staff that we work with, who is extremely hardworking and very talented in different areas of vascular surgery. Typically, we take care of very sick patients and do surgeries to prevent stroke, aortic aneurysm rupture, and also restoring blood flow to the limbs, as well as giving patients long-term dialysis access. So these are life-saving, limb-saving, lifestyle-saving procedures that we get to do, and we're extremely grateful.
The cardiology team here at USC is comprised of outstanding individuals who come to work every day caring with tremendous compassion, with extreme care, and a motivation to provide the utmost best care for individuals with complex cardiac needs.
So what are the best ways to maintain heart health? And that's included diet, exercise, really avoiding anything that can or will be smoked, no tobacco or even other products that can be smoked. It's basically thinking about the heart as this giant muscle that controls all of your existence. So avoid alcohol, lots of exercise that increase your heart rate, cardiovascular exercise. That's what is the best way to have a happy, healthy heart.
When people start struggling with exertion, and activity, there may be signs that the engine is running into problems. The symptoms people often have are chest pain when they're exerting themselves, shortness of breath, dizziness. They may notice swelling in their legs. Also, patients may notice abnormally slow or fast heart rates. These things are worrying signs that need urgent attention and should result in a review by a cardiologist. The other thing that cardiologists really do is preventative medicine. So people who have risk factors for developing heart disease should see a cardiologist so those risk factors are optimally managed. These include diabetes, hypertension, high blood pressure, and especially those patients who've got a family history of heart disease.
Mechanical circulatory support, or MCS, is a use of artificial heart and lung devices that help either support the circulation, the oxygenation and clearance of oxygen and carbon dioxide in the blood. We use these devices in different complex situations, but the overall arching goal is really to provide either heart or lung or heart and lung support to allow patients to either recover or move on to what we call advanced therapy, such as heart transplantation, or a device that will support the heart where you can go home with it, such as a left ventricular assist device. Currently, the most common two forms of mechanical support used in the United States is ECMO, which is extracorporeal membrane oxygenation, or an Impella device, which is a univentricular left ventricular assist device that is non-dischargeable, so used only inside the hospital.
Age group of over 60 years old, the most common heart rhythm disorder in this country is atrial fibrillation, which I'm sure a lot of you are familiar with. So we have come a long way with the treatment of AFib. The treatment of AFib is usually multi-pronged, and the most important one is stroke prevention, because stroke is usually irreversible and devastating. So the main treatment for stroke prevention in AFib is a blood thinner. The different types of blood thinner that are suitable for different patients, so your physician will have to tell you what kind. There are also procedural options that we can prevent stroke, such as the left atrial appendage occlusion device that one can actually undergo in order to avoid the side effects of a blood thinner, which is bleeding. In terms of treating the AFib itself to relieve symptoms, we have had a number of different medications over the years that we could try, but none of them are as good as our state-of-the-art catheter ablation these days. It's come a long way in the last 25 years. It's gone from being a 6-hour procedure with a 50% success rate to a 1.5-hour procedure with a success rate of over 80 to 85% in the right patient. So we encourage patients to really seek medical attention earlier so that we could treat the AFib at an earlier stage and achieve a bigger success. The third and usually not mentioned approach to AFib treatment is lifestyle modification. Even if the doctor and the patient are good with complying with the medications and doing the right procedure, there are things that patients can do for themselves, such as some of the risk factors we mentioned: controlling the blood pressure, losing weight to get to a BMI of less than 27. And if you have sleep apnea, treat the sleep apnea and regular exercise. All those things can actually reduce your recurrence of atrial fibrillation even with the best treatment.
TT Maze procedure stands for a totally thoracoscopic maze procedure. It's a procedure that we do for patients that have long-standing, persistent, symptomatic atrial fibrillation. With a TT maze, we're doing small incisions in the patient's chest and going in with a camera and small instruments to make ablations on the outside of the heart called the epicardium. One thing that makes the TT maze unique is that there's not many surgeons that are performing this procedure. This is a procedure that is technically challenging, and it's for standalone atrial fibrillation. So there are other procedures that are in a hybrid approach where you are working on the heart and the cardiothoracic surgeon is performing the procedure, that are a little bit less technically challenging, but this is the best chance for success, although it is done by fewer surgeons due to the technical challenges that it brings.